Today, we will explore acute hepatitis, a sudden onset condition affecting the liver. We will cover causes, clinical presentation, diagnostics, management, complications, and prevention. We will also discuss advanced topics like fulminant hepatitis and viral markers. Let's begin.
Acute hepatitis is commonly caused by viral infections, including hepatitis A, B, C, D, and E.
It can also be caused by other viral infections, drug-induced inflammation, autoimmune diseases, and metabolic disorders. Understanding the pathogenesis of acute hepatitis involves a complex interplay between viral replication, immune response, and hepatocyte injury. In viral hepatitis, viral particles invade hepatocytes and initiate replication, leading to the release of viral proteins and subsequent immune activation. This immune response can be both beneficial, aiding in viral clearance, and detrimental, causing hepatocyte damage. In drug-induced and immune-mediated acute hepatitis, the pathogenesis involves direct toxicity to hepatocytes or an aberrant immune response against liver antigens, respectively. The intricate mechanisms underlying these processes will be explored in greater detail throughout this lecture. The clinical presentation of acute hepatitis can vary widely depending on the etiology and severity of the disease. Common symptoms include fatigue, anorexia, nausea, vomiting, jaundice, and right upper quadrant abdominal pain. Physical examination may reveal hepatomegaly, jaundice, and signs of liver dysfunction. It is important for healthcare providers to recognize these clinical features and conduct a thorough evaluation to establish a definitive diagnosis. Diagnosing acute hepatitis involves an array of tests and procedures aimed at identifying the underlying etiology, assessing liver function, and evaluating potential complications. A comprehensive medical history, including exposure to viral pathogens or specific drugs, is imperative. Laboratory investigations, such as liver enzyme levels, AST, ALT, ALP, and bilirubin, viral serology, and autoimmune markers, aid in establishing the diagnosis. Additionally, imaging studies, such as ultrasound or magnetic resonance imaging, MRI, can provide valuable information about the liver architecture. In advanced cases or when a definitive diagnosis cannot be reached, liver biopsy may be necessary to evaluate hepatic histology. Acute hepatitis can give rise to various complications, some of which can be life-threatening. These include acute liver failure, hepatic encephalopathy, coagulopathy, and hepatocellular carcinoma. Understanding the pathophysiology and clinical implications of these complications is vital for implementing appropriate management strategies. The management of acute hepatitis is multifaceted and involves identifying and addressing the underlying cause, supportive care, and preventing further hepatocyte injury. In viral hepatitis, antiviral therapy may be indicated, depending on the specific viral strain. Supportive measures, such as adequate nutrition, rest, and close monitoring of liver function, are essential. In severe cases, liver transplantation may be considered. Treatment strategies for drug-induced and immune-mediated acute hepatitis will be explored in depth in their respective advanced topics. The prognosis of acute hepatitis varies significantly depending on the etiology, severity, and individual patient factors. Acute viral hepatitis, particularly hepatitis A and E, typically follows a self-limiting course, with complete recovery within weeks to months.
Hepatitis B, C, D, and drug-induced hepatitis may progress to chronic hepatitis, which can lead to long-term complications.
Advanced diagnostic tools, such as viral hepatitis serologic markers, can assist in predicting the prognosis and monitoring disease progression. Prevention plays a crucial role in controlling the spread of hepatitis A and B. Vaccination against hepatitis A and hepatitis B is highly effective in preventing infection. Additionally, adopting appropriate hygiene practices, such as hand washing and safe food handling, reduces the risk of hepatitis A. Awareness of modes of transmission, including sexual contact and intravenous drug use, is vital for preventing hepatitis B infection. Implementing universal vaccination programs and increasing public awareness are integral to achieving successful prevention strategies. Acute fulminant hepatitis represents a severe and rapidly progressive form of acute hepatitis, characterized by severe hepatocyte injury and impaired liver function. It is associated with high mortality rates and often requires urgent liver transplantation. Understanding the etiology, pathogenesis, clinical features, diagnostic approach, and management of acute fulminant hepatitis is paramount for early recognition and intervention. Drug-induced acute hepatitis occurs when certain medications or toxins trigger an immune-mediated response leading to liver injury. Recognition of potential offending agents, understanding the underlying mechanisms, and implementing appropriate risk mitigation strategies are crucial. Differentiating drug-induced hepatitis from other etiologies can be challenging, making a thorough diagnostic approach imperative. Management involves discontinuing the offending drug, providing supportive care, and monitoring liver function. Immune-mediated acute hepatitis refers to hepatocyte injury resulting from aberrant immune responses targeting liver antigens. These immune responses can be triggered by various etiologies, including autoimmune diseases and systemic hypersensitivity reactions. Diagnosis relies on serological and histological investigations, while management encompasses immunosuppressive therapy and treatment of the underlying condition. Viral hepatitis serologic markers encompass a broad range of serological assays used to detect and differentiate viral strains, determine the stage of infection, and monitor treatment response. These markers include specific antibodies, antigens, and genomic markers that provide crucial information for diagnosing and managing viral hepatitis infections. Understanding the interpretation and clinical implications of these serologic markers is key to comprehensive patient care. Acute hepatitis poses a major challenge in clinical practice. By exploring its causes, progress, symptoms, diagnosis, complications, treatment, recovery, and prevention, we aim to equip future healthcare providers with knowledge and skills to effectively address this condition. Understanding advanced topics like fulminant hepatitis, drug-induced hepatitis, immune-mediated hepatitis, and viral hepatitis serologic markers will further enhance your expertise. Let's make a difference in the lives of patients with acute hepatitis.